Hi friends, this is Onisha. Today we'll see questions related to head injury. So the first question is, the client has sustained traumatic brain injury, that is TBI, that is secondary to a motor vehicle accident. Which signs and symptoms would the emergency department nurse expect the client to exhibit? So there are four options: blurred vision, nausea, and right-sided hemiparesis. Number 2, increased urine output, negative Babinski sign and ptosis. Number 3, autonomic dysreflexia, positive Rudensky sign and hyperpyrexia. Number 4, negative dystrophic knuckle rigidity and nystagmus. So after traumatic brain injury, what emergency department nurse would expect? What signs and symptoms the emergency department nurse would expect? So that is the question, and we have four options. So we'll see the answer. So the correct answer is first one, that is blurred vision, nausea and right-sided hemiparesis. So we'll see the rationale or reason for why we have chosen this first one answer. So correct answer is first one, because your signs and symptoms for traumatic brain injury will include your neurological deficits. So neurological deficit signs and symptoms are blurred vision, nausea and right-sided hemiparesis. So why not the other answers 2, 3 and 4? It has some negative Babinski sign, okay, a positive Rudensky sign, autonomic dysreflexia, negative dystrophic. So why we excluded all these signs and symptoms? So a positive Babinski sign will be occurring in head trauma. An autonomic dysreflexia sign that will be found with the client of spinal cord injury, not for traumatic brain injury patients. And another thing, a positive dystrophic for glucose, that will be found only if the patient is having CSF leakage or cerebrospinal fluid leakage. Okay, and a positive Rudensky sign and knuckle rigidity. These are the signs of meningitis. Okay, brain fever, we call it as meningitis. So we excluded all these signs and symptoms, and so the answer for your question is blurred vision, nausea and right-sided hemiparesis for traumatic brain injury patients. Okay. We'll move on to the next question. Here, the intensive care nurse is caring for a client diagnosed with a closed head injury. Which data would warrant immediate intervention? So, when a nurse need to have immediate intervention, that is the question, and we have four options here. First one, the client refuses to cough and deep breathe. Second one, the client's Glasgow coma, that is GCS, goes from 13 to 7. And third one, the client complains of a frontal headache. And the fourth one, the client's mini mental status examination, that is MMSE, is 30. So we will see what is the correct answer. You may also guess some of the correct answers. What is the exact correct answer? Is the option 2. The option 2 is the client's Glasgow coma scale goes from 13 to 7. Okay, that is the correct answer. So why we excluded the other things? Okay, this refuses to cough and deep breathe, that is insignificant. And also the complaints of frontal headache also doesn't need an immediate intervention. And your MMSC, mini mental status examination 30, that indicates a client is cognitively intact. So correct answer 2, a Glasgow coma scale that will decrease from 13 to 7. So that indicates that the client is neurologically, okay, there is problem. So 15 Glasgow coma scale, GCS 15 will indicate that the patient is neurologically intact, and if the patient is having decreased GCS, that too if it is go to 7, that indicates an increase in the ICP, that is intracranial pressure. So that needs an immediate intervention. So that is why the correct answer goes, the client's GCS or Glasgow Coma scale goes from 30 to 7. Okay, we'll move on to the next question. The rehabilitation nurse is caring for the client with a closed head injury. Which cognitive goal would be most appropriate for this client? Okay, the first option we have is the client will be able to feed himself or herself independently. Second, the client will attend therapy sessions 3 hours a day. The client will interact appropriately with staff members. The client will be able to stay on task for 15 minutes. So the correct answer for this one is fourth option. The client will be able to stay on task for 15 minutes. This is the cognitive goal that is most appropriate for the client. So why? Because cognitive is mental functioning. Therefore, the ability to stay on task would be the client's most appropriate cognitive goal. So in these options, the best cognitive or appropriate cognitive task is the number 4th option. The client will be able to stay on task for 15 minutes. So that is the exact correct answer for this question. So today we have reviewed 3 questions and their answers and the rationale behind the correct answer and what we have to exclude it. What we have to exclude, why we are excluding the other 3 options we have seen. Hope you have understand. All these questions are related to closed head injury patients. Okay, so to have more videos like this, subscribe this channel. We'll upload more and more videos like this, question and answers related to like disorders which will be asked in JIPMER, AIIMS and other nursing competitive exams. Thank you.